heart disease, stroke, diabetes, and cancer rising steadily. These conditions develop silently over time, often going undetected until they become life-threatening. This shift has created what public health experts describe as a double burden of disease. Kenya must continue fighting infectious diseases while simultaneously managing a surge in chronic illnesses that require long-term care, early screening, and sustained treatment. The health system, already stretched by limited personnel and uneven resources, is being pulled in two directions at once, struggling to respond to emergencies while also addressing diseases that demand prevention and continuity of care. At the heart of this crisis are deeper systemic challenges: high internal mortality or maternal mortality, shortages of doctors, rural-urban inequalities, and the economic toll of illnesses on families. Many of these deaths are preventable with timely diagnosis, proper staffing, and stronger primary healthcare systems. Kenya stands at a crossroads, confronted not by a single catastrophic event, but by a steady accumulation of avoidable tragedies that will shape the nation's future if decisive action is not taken. This is Kenya on life support, a silent earthquake. The 25th day of Feb 2026. My name is Jeffrey Kimaiyu Somba, and this is the midweek report. My sign language interpreter is Alfred Mwangi, and we are beginning first with the explainer, and it's all about the health crisis that we are facing in this country. And there is no siren, no national emergency announcement, no dramatic outbreak dominating the headlines, and yet across Kenya, in BC County, hospitals is in rural dispensaries, in private clinics tucked into urban estates, a quiet crisis is unfolding. It is steady, it is persistent, and it is claiming lives every single day. The question is no longer whether Kenyans are dying. The question is what exactly is killing them. For decades, the answer would have been simple: malaria, tuberculosis, HIV/AIDS, pneumonia, infectious diseases defined our public health battles. They shaped budgets, donor funding, awareness campaigns, and hospital awards. But that answer is no longer complete. Today, Kenya is facing something more complex and far more dangerous. We are living through a health transition, and many of us do not even realize the silent shift. And non-communicable diseases, heart disease, stroke, diabetes, cancer now account for roughly 40% of deaths in Kenya. And 40%, these are not illnesses that spread through mosquito bites or contaminated water. They do not erupt suddenly. They grow quietly in arteries narrowing over years, in blood sugar levels rising unnoticed, in cells dividing abnormally until it is too late. And for a long time, these conditions were associated with wealthy nations, sedentary lifestyles, processed foods, aging populations. But Kenya is changing. Urbanization is accelerating. Diets are shifting. Physical activity is declining. Stress levels are rising, and the diseases once labeled lifestyle illnesses are now embedded in everyday Kenyan life. The danger is not just that they are increasing. The danger is that our system was not built for them. Fighting T was at once, and like high-income countries that gradually transitioned from infectious diseases to chronic illnesses over decades, Kenya must fight both. And at the same time, malaria has not disappeared. Tuberculosis still spreads. HIV still requires lifelong treatment, and at the very same time, clinics are now seeing surges in hypertension, stroke, kidney failure, and cancer. This is what public health experts call the double burden of disease, and it stretches an already fragile system in two directions at once. Dying while giving life perhaps nowhere is the crisis more painful than in maternity wards. Kenya records approximately 355 maternal deaths per 100,000 live births. To understand what that means, consider this: the global target under the Sustainable Development Goals is 70 per 100,000. Kenya rates 5 times higher. Behind that number are women who die from bleeding that could have been stopped, infections that could have been treated, high blood pressure, complications that could have been managed. In many high-income countries, maternal mortality falls below 10 per 100,000. The gap is not just statistical, it is moral. It reflects uneven access to emergency obstetric care, delayed referrals, shortages of skilled birth attendants, and overwhelmed facilities. When a woman dies during childbirth, it is rarely just one life lost. It destabilizes families, leaves children vulnerable, and deepens poverty and the human resource crisis. And a healthy system is only as strong as the people who run it. Kenya has approximately 0.89 doctors per 10,000 people, and less than one doctor for every 10,000 citizens. In many middle-income countries, that number is 10 times higher. In wealthier nations, it can exceed 30 per 10,000. So what does that shortage look like in real life? It looks like a long queues beginning at dawn. It looks like doctors seeing dozens of patients in a single shift. It looks like delayed diagnosis because there simply isn't enough time. It looks like burnout when there are too few hands to carry the load. Mistakes increase, exhaustion rises, and preventable deaths become more likely. And the cost of late diagnosis and one of the quiet tragedies of non-communicable diseases is how often they are discovered too late. High blood pressure has no early warning siren. Diabetes can progress silently from years. Cancer symptoms are often ignored until they interfere with daily life. By the time many patients seek care, the disease is advanced, harder to treat, more expensive to manage, less likely to be cured. Prevention is cheaper than treatment. Screening is simpler than surgery. Early intervention saves both money and lives. But prevention requires infrastructure. It requires awareness campaigns. It requires routine checkups that men cannot access or afford. Urbanization and risk. Kenya's cities are expanding rapidly. With urban growth comes opportunity, but also risk. Processed foods high in salt and sugar are more available than ever. Sedentary jobs replace agricultural labor. Communities or commutes replace walking. Pollution increases respiratory strain, and stress becomes constant. Hypertension is no longer rare in people in their 30s and 40s. The country is growing younger, but its diseases are aging faster. Regional and global context, where globally non-communicable diseases account for nearly 3/4 of the deaths, and Kenya is not unique in facing this transition. What makes Kenya vulnerable is that the shift is happening before the health system has fully stabilized. Maternal mortality remains high compared to global targets. Doctor ratios remain far below international averages. Now, rural-urban disparities persist, and in some counties, access to specialized care requires hours of travel. Emergency transport can be unreliable. Equipment may also be limited, and a complication that would be routine in one region can be fatal in another. The economic ripple effect, where illness is not just a medical issue, it is an economic one. Chronic diseases require long-term medication, repeated hospital visits, specialists and consultations, laboratory tests. Many families pay out of pocket. A stroke does not just disable a person, it removes a breadwinner, and cancer diagnosis can drain savings. A maternal death can destabilize entire households, and health shocks are one of the leading drivers of poverty in many developing economies, and the cost of inaction compounds year after year. And the rural divide geography still determines survival. Urban counties often have more doctors, better equipment, and quicker referrals, and in rural regions distances are longer and resources thinner. When a mother begins hemorrhaging in a remote village, minutes matter. If transport is delayed, if the nearest facility lacks blood supplies, and if trained staff are unavailable, the outcome can turn fatal. Health inequality in Kenya is not just about income, it is about location. The preventable tragedy. What makes this crisis particularly painful is that much of it is preventable. Hypertension can be detected with a simple cough. Diabetes can be managed with lifestyle changes and medication, and maternal deaths can be reduced dramatically with skilled birth attendants and emergency obstetric care. And countries that have reduced heart disease, invested in prevention and tobacco regulation, salt reduction campaigns, public exercise initiatives. Countries that slashed maternal mortality, strengthened primary health care, trained midwives, and ensured emergency services reach rural areas. The blueprint exists. A question of priority. Health reform is not only technical, it's political. Budget allocations determine staffing, policy decisions shape insurance coverage, leadership influences accountability. A nation's health reflects its priorities, and the choices made today will determine whether the crisis deepens or stabilizes a nation at a crossroads. Kenya has made undeniable progress over decades. Life expectancy has improved, HIV treatment expanded, child mortality reduced, but progress is uneven. Some counties thrive while others struggle, and some hospitals modernize while others strain. The statistics tell a story of transition, a country moving from one health era to another without safety net strong enough to catch everyone. The final question: this is not a hopeless story. It is a warning. Kenya is not collapsing, but it is under strain. The greatest threat is not a single virus or outbreak. It is the slow accumulation of preventable death, the silent crisis unfolding in examination rooms and maternity wards across the country. And the question now is not whether Kenya can confront this reality. The question is whether it will act quickly enough to prevent the next statistic from becoming the next tragedy. Because behind every number is a name, and behind every name is a family, and behind every family is a nation whose health will determine its future. That is the crisis we have in Kenya. Coming up next is the Midweek Report with me, Jeffrey Kimaiyu Somba. Updates, and you can watch this program through our social media platforms, that is at EBN TV Kenya. Across our SMS line is 23059. My sign language interpreter again is Laura Omonti, and we're starting off with the news updates. Now, President William Ruto has criticized opposition leaders for what they called empty rhetoric that does not benefit Kenya's development. Speaking during a visit to Westlands and Kabete to inspect development projects, the president said his government has fulfilled its promises over the past 3 years. President Ruto also inspected the construction of affordable housing in Kabete and handed over 16 new classrooms and Kangi Primary School. He emphasized that his priority is to deliver on the development agenda before the election campaign period begins.
Riziki. Hii manyumba yote tunajenga Kenya. Hakuna deni ya mtu tumekopa. Nyinyi mnanielewa? Na mimi nilisema tutakomesha mambo ya kutafuta madeni kiholela. Tumepunguza mambo ya madeni. Tumehakikisha ya kwamba we are living within our means. Tumeimarisha mambo ya uchumi wa Kenya. Tumepanga elimu ya watoto wetu. Mimi leo naenda kufungua madarasa ya watoto wa Nairobi County. Tumejenga madarasa 314. Wabunge wamejenga madarasa 500 ili tuongeze nafasi ya masomo ya watoto wetu hapa Nairobi County. Nyinyi mnasema tuendelee ama tuendelee, my friends? Wa Nairobi County tumejenga madarasa 314. Wabunge wamejenga madarasa 500 ili tuongeze nafasi ya masomo ya watoto wetu hapa Nairobi County. Nyinyi mnasema tuendelee ama tuendelee, my friends?
Away from that story, Battled ODM Secretary General Edwin Sifuna has opposed any plans to have a deadline extension for the Memorandum of Understanding between ODM and UDA on the implementation of the 10-point agenda. Sifuna says the government has not shown seriousness and commitment in honoring the agreement, whose deadline is set to lapse in the next 9 days. He argues that if President William Ruto has failed to honor the commitment, he won't honor any negotiations with the Linda ground faction of ODM.
Ambalo tunawauliza hawa ndugu zetu ambao wako kwenye hii broadcast. Iwapo William Ruto anaweza kukiuka mkataba ambao umetiwa sahihi na Raila Odinga mwenyewe. Nyinyi mnatuambia mnataka kuanza mazungumzo tena muweke mkataba mwingine. Kama mtu hawezi kufuata mkataba mdogo kama huu, Ni yapi ambayo mnafikiria mtasikizana na afuate? Haitawezekana. Sababu kwa hivyo mtu yeyote ambaye anakaa mahali anawaza anafikiria ati anaweza kuenda assign extension ya hii mkataba, lazima uende Bondo uchukue signature ya baba.
And moving on, the Kenya Medical Practitioners and Dentists Council has now started a formal partnership with the regional police in Nairobi in a move aimed at tightening enforcement of health facility standards and flashing out illegal operators. This comes amid growing concerns following recent cases of malpractices involving dentists operating outside regulatory guidelines. The officials stated that the partnership will support enforcement, including closure of facilities that do not comply with the regulations. The council also plans to strengthen monitoring and reporting systems to ensure timely action taken against violators. This joint effort is expected to improve coordination at the local level and protect residents from unsafe healthcare practices.
We shall be sharing the lists of legal health facilities across all regions in Nairobi to the county commissioner and his teams to continue helping us enforce those that are illegal to be kept out of the system, because we want Kenyans to receive services only from facilities that are legitimate and have qualified staff to work within them.
To give the assurances that we are going to work with them so that we cap this issue of illegal practitioners working in our areas of jurisdiction. We have all the security committees and they have been enlightened on implementation of the KMPDC program.
Opposition leaders have stated that they plan to offer Kenyans an alternative government in 2027 elections. They emphasize that they will not allow any attempts by the current administration to manipulate or rig the general election. Speaking today during a visit to Ogambo, Kenya and Yamache in Kisii County, the leaders said they are prepared to take all necessary measures to prevent the Kenyan government under Kenya Kwanza from investing or divesting 15% of its stake in Safaricom.
Tumeamua tutakuwa demokrasia ya vyama vingi. Kwa hivyo kila mtu ako na uhuru, hata wao wako na uhuru kufanya siasa yao ya vyama vyao.
Juzi hapo Keroka na Kisii Town umepanga wahuni ikuembo your nephew na mapanga waumiza Matiang'i na marafiki zake, waumiza wamama, waumiza watoto. Wewe huna adabu, unachaguliwa na watu ya Kisii. Siku kubwa ya ndugu yako akifanywa mfalme wa Bogusi, unapanga wakora kuja kupiga ndugu yako nyumbani.
Hiyo damu ya watoto wa Kenya haiwezi kuwa ilimwagika bure. Tutahakikisha kwamba haki inafanyika. Haki kwa kila mwananchi wa Kenya, haki kwa mtu wa Gucha, haki kwa Mkisii mahali alipo.
And the Kenya National Highway Authority, Kenya, has announced plans to construct a new 880-meter section near the bridge and expand the adjoining roads as part of major infrastructure upgrade aimed at reducing deadly accidents and providing a safer transport corridor. Speaking during a public participation forum, Kenya Deputy Director Michael Angala said the project will also involve the reconstruction of 2.7 kilometers of road with an expected completion period of 24 months. The new alignment is designed to eliminate sharp bends and steep hills that have contributed to frequent accidents.
And they would also come again on the ground to engage the public and those affected.
Our Masolofea, the engineers, they move to the ground so that we can have the work done as fast as possible. Ndio hiyo ndio itawafanya wajue ni gharama, ni mashamba gapi ambayo wanatakiwa, ekari ngapi wanatakiwa serikali inunue.
Tumeamini sasa serikali imetusikiza, sababu watu wameishia hapo wengi sana. Tangu mwaka wa 1985 wakati hii barabara ilifunguliwa, kulikuwa na changamoto ya ajali nyingi sana. Kwa hivyo tumepoteza watu, wengine ni viwete, na sasa tumefurahia.
Now look at this, and despite the government pushing for 100% transition of all students to grade 10, a large number of students have reportedly stayed home, especially in the Marungu area. And speaking in Marungu Voi during a ceremony marking the release of results at Marungu Secondary School, the 8 teachers and their deputies admitted to delays in implementing the government directive to ensure every student joins school, while warning that heads of schools could be dismissed if they fail to take responsibility. Voi MP Ms. Chome commended government efforts through constituency funds to strengthen the educational infrastructure in the area.
Tutafute kiwanja mahali ambao ni central, ikiwa watoto wa kutoka Ngulia, wa kutoka Sagala, wa kutoka Mbololo, Marungu, Kasigau, Kaloleni, wote wanaweza wakaja kwa shule ile, iwe ni shule moja inahudumia jamii zote za Voi.
Darasa grade 10 wako wanafunzi 50 kama sijapata vibaya. Inamaanisha nini? Bwana Chief, inamaanisha wazazi wa hapa hawajaleta watoto kulingana na venye serikali ilisema 100% transition. Hii shule inahitajika iwe na wanafunzi wa grade 10 zaidi ya 100 na. Director, ni ukweli ama ni uongo? Chief Maungu na zenchifu wako mumelala. Wanafunzi waletwe.
And some classrooms have collapsed at Matulo FYM Primary School due to heavy rains. Some students in the school located in the Webuye West constituency are studying under trees after parts of their classrooms fell, while the walls of other classrooms have developed cracks. And speaking to journalists, the chairperson of the school committee, Moses Kaemba, said that the ongoing heavy rains in the area have caused the classrooms to start collapsing, putting the students' lives at risk.
Tuliambiwa tuangushe madarasa 14. Na tukiangalia wakati tulikuwa tunalilia wasaitisi, ikapatikana kwamba hata hali ya anga haituruhusu tuendelee kuzitumia.
Yenyewe imeadhiri masomo ya wanafunzi. Shule yenyewe ukiingia, it's not even appealing. Inahitaji mijengo mizuri, inahitaji mazingira mazuri. Watoto wawe smart, walimu wakija hapa pia wawe motivated.
Watoto wetu hatuna haja wapate changa ndio wakimbie waseme wakuje kusaidia. Tafadhali tusuie kabla janga halijatokea.
The Garissa County government has been criticized for negligence in addressing the ongoing drought crisis. Speaking to journalists at the County Assembly, Ashila Ward Representative Nashue Farah said that the county government has not demonstrated effective strategies to tackle the disaster, which has left many residents without food and caused livestock losses. Farah explained that in many drought-affected areas in the northeastern region, efforts to address the crisis have increased, including food and water distribution in collaboration with the national government and development partners.
Not only in Garissa County, the entire northern region. What I fail to actually understand is that for the last 4 years that we have been here, we have been passing a budget in terms of millions and millions. And for the last 4 years that we have been here, no one single cent has been used in terms of drought or any other disaster.
Stakeholders and lawmakers are urging the government to provide comprehensive data on children and families living on the streets to address the challenges faced by homeless people in the country. Led by Executive Director Eric Mukoya, Senator Okia Omutata and MP Karoli Omonti have taken a stance, and the government should release complete data and review relevant laws, collaborate with communities and other stakeholders to ensure that homeless families gain proper housing, as they have a fundamental human right to shelter in Kenya.
The government doesn't have the right numbers, because we have numbers for 2018, which we also think were arrived at from formal conversations, not informal conversations. Because for you to reach street connected people, you must have some informal arrangement or a tool that can get you there. Our assumption is anything between 300,000 and 500,000 in this country. The question is this: when we are doing things without knowledge, without evidence, what are our programs?
As part of addressing this question of homelessness, which basically is a symptom of a dysfunctional economy, let us focus on Chapter 12. Let us get the institutions that are prescribed there in place. Let government be run as prescribed in the Constitution in Chapter 12, and we shall be able to have money and the ability to begin intervening.
In terms of what we are discussing, there is homelessness, but there's also the question of inadequate housing. And then there's the question of urban homelessness and inadequate housing in rural areas. It is not just something that is limited to the urban areas. You can't solve the issue of homelessness or inadequate housing if you don't address the question of affordability and incomes.
We're not merely hoping, we're committed to actively realizing a future where every vulnerable child, every youth, and every family in Nairobi has the undeniable opportunity to thrive, completely free from the suffocating grips of citizen and homelessness.
And leaders in West Pokot County have demanded to be included in Lokichar oil extraction projects. The leaders have vowed to block the use of Takwel water in oil drilling at the southern Lokichar wells if West Pokot residents do not benefit from the public-private partnership agreements. The statement follows a public participation meeting held at the Takwel site regarding the development plans for the Lokichar South oil projects. The meeting were organized by the National Assembly Energy Committee in collaboration with the Senate Energy Committee. Residents noted that although the oil wells are in Turkana, the water used comes from the Takwel Dam in West Pokot, and therefore the county should directly benefit from the project's revenues. The leaders also cited the 2019 Energy Act, emphasizing that West Pokot deserves a share of the oil revenues because its water is crucial for production.
Kukunywa na maji ya mifugo yao na pia waweze kufanyiwa irrigation. So hiyo ndio the first point ambayo ndio tuweze kuzungumza mambo ya hii maji.
Ni lazima sasa pahali maji yanatolewa ipate faida ya maji yake vile ilivyo katika Kenya kwa projects nyingi.
And by the grace of God, in natural resources iko kwa the two communities imekuwa na shida mingi for a long time. Oil Turkana, maji wa Pokot. Tumesoma documents zinasema maji haya yote yaende itoe oil. Hakuna mali imeandikwa kwa hii document what profit, what share goes back to the owners of water.
Hii jamii yote mbili wameumia kwa muda mrefu sana. Hata ile fita natoka huko ni kwa sababu ya njaa. Kwa hivyo nataka niulize wale ambao wanahusika, Wizara ya Maji, Irrigation, waitishe mkutano haraka na watuambie ni nini ambayo inaendelea.
Agriculture Cabinet Secretary Mutahi Kagwe has urged county governments to adopt investor-inclusive systems as a way to boost agriculture in the country. Speaking at an agricultural conference organized by the Coastal Counties Association in Malindi, Kagwe said the national government cannot fully fund this sector alone. He also warned that if the allocation of land plot is not properly regulated, it could negatively affect the agricultural sector in Kenya.
The need for counties and the national government to engage the private sector to come to us. So the same way we are giving land in in Galana Kulalu and elsewhere, ADC farms, prison lands, Kalo lands, that we are now going to land commercialization initiative. I want to persuade the counties to be very passionately involved in attracting private sector into their areas and getting them to work.
As you know, cashew nut used to be a huge economic activity in the coast. So we have come here to continue with the motivation of our farmers to continue growing these crops, especially as you know, the coconuts are now very old. We need to revitalize them. Cashew nuts are very old. We need to revitalize them. And from Lamu, Kilifi, Kwale, we have been distributing seedlings of coconuts to the farmers.
We are truly to revitalize agriculture in the region. We must also embrace digitization as a game changer. The future of agriculture is digital. Digital farmer registration systems can improve planning and targeted support.
And 3 people have been arrested by police officers working in collaboration with KWS after they were found with only 1,000 kilograms of game meat, specifically zebra, at their residence in Kikambura, Kikuyu, Kiambu County. While confirming the incident, KWS Senior Assistant Director in charge of Southern Area, Joseph Ndachacha, said the 3 were in the process of mixing the game meat with livestock meat that has been slaughtered at the facility.
Joseph Dadacha. I am Senior Assistant Director in charge of Southern Conservation Area to a residential house. Now our officers stormed into the house, and upon searching in the house, they found 6 packs of deboned meat weighing about 500 kilograms. Upon further search, they were able to also discover a fully dismembered carcass of a zebra, which was awaiting to be deboned in the same house. Now, in this one incident, our officers have managed to recover.
That story brings us to the end of the midweek report. My name is Jeffrey Kimaiyu Somba. My sign language interpreter is Laura Omonti. Thank you for the team that has made this bulletin a success. And from this team, we wish you a beautiful night. Till tomorrow, may God bless you.